Dear colleagues, welcome to our monthly dialogue with leaders in cardiology from the 5 continents. In our archive, we already have more than 40 dialogues with the most important cardiologists from the world. And in these dialogues, of course, we share with our important guests their science, but our goal is also to unveil their human side, which is extremely inspirational, in particular for our younger colleagues. As you know, this is live streamed and will be posted in YouTube. And all your questions are very welcome. Please, if you have questions, you can write your question in the chat, or you can raise your hand and we will invite you to ask directly your questions. And let's come to the dialogue today. As usual, we have a famous guest. Today is Tom Guzik, and the title of the dialogue is An Inspiring Scientist, Editor-in-Chief, and Humanitarian Doctor. And I will host him with another famous colleague, Cecilia Linde, Executive Editor of the European Heart Journal and President-elect of the European Society of Cardiology. Welcome to this dialogue, Tom and Cecilia. And Cecilia, please, can you introduce our famous guest?
Thank you so much, Filippo, and it's my true pleasure to introduce Professor Tomasz Guzik. Professor Tomasz Guzik is the chair of the cardiovascular medicine at the University of Edinburgh and holds simultaneously a professorship at the Jagiellonian University in Krakow in Poland. His research focuses primarily on identifying novel mechanisms and therapeutic targets in hypertension and atherosclerosis, and key achievements of his group include elucidating oxidative stress and vascular dysfunction mechanisms in humans, which has led to identify new roles for inflammation and adaptive immunity in hypertension, leading to new therapies in cardio-oncology. His primary focus is translational approaches such as omics and understanding disease pathology, and he has received a number of awards, including Arthur Cochrane Hypertension Award, Marshall Award in Cardiovascular Research in UK, and the Tigerstedt Award. And he has been recognized as a highly cited scientist with many papers, cited more than 1,000 times. From 2018, Professor Guzik serves as Editor-in-Chief of Cardiovascular Research, and he leads the British Atherosclerosis Society and is a board member of the European Society of Cardiology. And finally, and importantly, he also chairs the ESC Congress Program Committee. So I could go on, but I will stop here because we'll go to the questions now. And my first question is a personal one to Professor Guzik, to Tom. Please, how did your passion for medicine start? Did you always know that you wanted to become a doctor?
Thank you very much for an opportunity to chat here with you. I always watch the dialogues with great interest, and they are always inspiring to me. So it's a huge honor for me to be here. And it's also a good opportunity to also, I think, open a discussion regarding how our ESC Congress is supposed to look like. So, so at this occasion, Filippo, Cecilia, thank you very much for having me here. But it's a very important question for me as well. Indeed, it is actually more personal than you may think, because I think my passion for medicine started with my mother, because my mother was a physician, and she was an academic physician in Krakow in Poland. And throughout all my childhood and all the years, I could have observed her work and devotion to the patients, and really a huge engagement that she truly gave her whole heart to patients. And I think if you see something like this throughout your childhood, you have no other choice but follow this route and continue down the same path. So I think this has indeed initiated this. And in fact, my brother also became a physician. And when my mother died, I kept seeing some patients that were her patients initially. And I have to say that some of them, when they were speaking about her, they started crying. And to me, it was sort of an indication of the real measure of success, because I think we may think of various things, but since then I define success as having somebody who is not linked to you very closely, in some way, almost a random person, cry when they speak about you 5 years after your death. I mean, that is the real success, I think, and I think that is what we should all strive for. And medicine gives an opportunity to touch other people's lives, and I think that is how it started. Sorry, you said it was personal, so I went a little bit more personal maybe than expected, but this is the truth.
But it's a wonderful story, and the patients go for generational into the next generation of doctors. That's absolutely wonderful. So continuing now to your personal career, you were born in Poland, lived in the United States, and then also work in Scotland. It is not easy to change environments like this. What is the secret of doing it?
So indeed, it is not maybe easy to do this, but it requires this sort of adaptability, and this adaptability, I think, is built in science and being a scientist, because it comes from curiosity, openness to new perspectives. It teaches appreciation for different cultures, and I think overall something that really combines us all is science. It really science, interactions with young colleagues throughout the world that we develop over these years. And I think one of my mentors in the past has told me that being a scientist is really the best job in the world, because the first thing is you have friends everywhere you go. And this is indeed true. We really are blessed with friendships that develop and start from science, but continue beyond, and wherever we are, we can develop this. But I think the sort of adapting to life in different cultures and places is very educational. In Poland, we have this saying that traveling is very educational. It teaches you things. And there was also a certain time, in the 80s and the 90s, most of scientists from Poland, they were always traveling to foreign universities and countries, and they in order to progress their careers. And then after 90s, when quality of and access to equipment have improved in Poland, this has started slowing down, and there were some labs and some groups that were saying, you don't need to go to the United States, you don't need to go to Germany anymore, because you can do everything here. You don't need to go to the UK. But I think part of the secret is that it's not about access anymore. I mean, we have access to collaborations, we have access to technology anywhere we work at the moment. It's about learning the culture, and learning the culture that you see by working with excellent scientists. And I had this privilege, first in the UK, in Oxford. I worked with Keith Shannon, who has taught me a lot. Then I had a chance to spend a substantial amount of time in the United States at Emory University working with David Harrison. He has shown me how the scientific thinking operates, and how you shouldn't worry too much about everything that I always worried about too many things that could actually, it's very important to be predictive and to be careful, but it should not be paralyzing. So each of these elements brings something unique to a scientific journey. And then, as I mentioned, you meet various colleagues with whom we work at the same bench, we work in the same clinical ward, and these relationships and friendships remain forever. And I think I find this one of the most rewarding part of our work, that we can actually share our life between different cultures and countries.
So just a quick follow-up question. Do you think in the scientific milieu in the lab, does it differ between these different 3 countries, or is it the same once you are started working there in the lab?
So of course it differs, but it has the common element. I think there is more similarities than difficulties. There are different obstacles and different difficulties that we are facing, but I think that the really something that I appreciate very much is colleagues that I can work with, and these aspects, they do not differ, and we have international participation, international groups in our group in Poland, and the same in the UK, and collaborators throughout. And I think this is something that is similar. Of course, there are differences in levels of funding. There are differences in expectations that different scientific systems put on their scientists. And I think this is probably one of the very important and potentially, you could even say, a bit sort of dangerous thing for some of the regions where in some countries it's more important to publish a lot of papers, and people don't pay attention to the discovery itself. They develop their scientific careers by just publishing paper after paper, and I think something that I have learned from my mentors is that to focus on the work and on the discoveries, and then papers come as a result of this. And I think this is a common theme that should be the same across the board.
Thank you. And then
but maybe if I can just add about this, because when you were asking, I actually think we are here at the dialogue of the ESC journal, and from this perspective, I think this is also a key element why I enjoy being involved in the ESC, because ESC is actually such a melting pot. Is a place where all these different cultures are meeting together, and I think it's unique for the European society, because we really conglomerate people of truly very, very different cultures. Some of the other large cardiology societies and associations are more sort of, even if they conglomerate international audiences, they are usually more focused on certain regions than others, and they have maybe more similarities than differences. And within ESC, we actually are opposite. We have people from completely opposite ends of not only continent, but the world.
So the ESC is cardiology, and how come you choose cardiology, and what was your first scientific passion in that field?
So it was so my first scientific passion overall was actually allergy and clinical immunology, and I wanted to be an allergologist, but then I ended up in Oxford in the Department of Cardiovascular Medicine, working with Keith Shannon, and during my studies there, the Oxford system has this system of advisors. So you have a supervisor that looks after your scientific development, and you have an advisor that looks at your general development. And my advisor was Sir Richard Peto. And he met with me. The advisor would meet with a student several times a year just to talk, to discuss, and sort of ensure that the student is fine and is developing well. And he told me, when I was starting to convince him, I knew he was a very famous epidemiologist. I was thinking maybe we do some studies in allergy because it's so interesting. At that time, allergy prevalence was rising very dramatically across the world. And I say to him, listen, Sir Richard, maybe we should do this, analyze this between Poland, UK, and other countries. And he says, Tom, I only work with diseases that kill people. And I say, well, but maybe bee allergy kills people. And he says, okay, I will modify my statement. I only work with diseases that kill millions of people. And I think this utilitarian approach, this is something that is sort of a backbone of interest in cardiology, where we are dealing with the biggest killer of our population, and I think working with people like Keith, like David Harrison, I think has sort of made this passion for cardiovascular medicine and cardiology grow. And within this, one of the first focus and passions was to understand, how blood vessels work and what is the difference between different models of blood vessels and human blood vessels. And working in Oxford, I was always focused on characterizing the mechanisms of vascular function in human vasculature. We used models of saphenous veins, mammary arteries, coronary arteries to try to say, how these pathologies and signaling processes that are well described in cell culture, in animal models, are playing out in the human vasculature. And sometimes we were criticized because, people were saying, well, why are you studying veins, for example? And it made us realize that, while of course, when we look at coronary artery disease and study veins, it's just a model system, but it is one of the ways to address the question. And in response to some of the reviewer comments, we once even wrote to the reviewer saying, we accept the criticisms that vein is not getting atherosclerosis, but is exposed to the same milieu, and we don't think that it's actually a much worse model than a cell living on a plastic background in 37 degrees. And I think it generally was a very exciting time.
So, Thomas, we need to be really thankful to Sir Richard Peto for advising you in the proper direction.
I think we can be thankful to him for many, many other things in the first line.
Yes,
Because really,
I may add that
many
he
people don't know, maybe it's worth mentioning, he's actually a person who discovered that smoking causes cancer.
Yes.
In general terms. So it's very big simplification, of course, but I think people always, when they hear this, they say, well, this is of course a certain thing, but somebody needed to describe this and discover it.
Well, let me add that he's Dr. Honoris Causa at the Karolinska Institute, which is really difficult to become. So let's proceed. Out of all these that you just said, what do you think is your major achievement? Or is there probably numerous, but if you just pick one?
I think it is a very difficult question, and the truth is that if you ask me this way, I think that what I considered the greatest achievement is a chance that I managed to develop collaboration with a large number of young people both in Poland and in the UK. Who work with me, trust me in sometimes very difficult decisions that we make to keep working on a project in order to publish in a better journal, to develop the story in full instead of getting a few smaller papers. So I think getting their trust and the fact that I could convince them as well to this idea of science that is focused on discovery rather than writing papers. I think this is what I consider a huge honor and I would say a success. Of course, I have been involved in very exciting work scientifically as well in the past, together with these colleagues both in Poland and in the UK recently. But these are, aspects focusing on inflammatory and immune mechanisms of hypertension, work that we started when I was working at Emory University with David Harrison, and understanding how free radicals and oxidative stress mediates vascular dysfunction, various conditions, and a recent work that actually was performed almost completely in Poland, where we, working with Piotr Szczepaniak, we characterized the mechanism through which some of the chemotherapeutic drugs are actually causing vascular dysfunction and are affecting blood vessels, not only the heart, which other people focus. But I think really, if you think about something that I consider a success, I think, is linked to a chance to convince young colleagues to work with me, even though it's
That is
difficult.
beautiful
I do
music.
appreciate.
Beautiful music, yeah. Fostering new scientists is so important, and it's wonderful that you, who are so successful, put this as the first. But were there any difficult moments in your research career, or didn't you have any?
I think the difficult moment is always when you describe something new. There is very large number of people that don't want to believe this. And they say this is impossible. They say, well, this is all impossible. You should not you should do something different because this is stupid. It's impossible to do this. And then there is a second group of also, and this is very difficult, especially for relatively young scientists. If some very famous person comes and says, well, Tom, if this was true, it would have been already known before. I mean, these two things I consider very difficult because even if you think, of course, you build some sort of psychological defenses against this sort of comments, they do affect you and they do make you question the concepts. But I think in the end, it's important to always follow the concept of Sir Karl Popper, and the idea of falsification in science, and maybe actually these sort of difficult moments and the moments where people question your hypothesis are the most important for strengthening it and perpetuating it. And we had this, for example, when we described inflammatory changes that accompany hypertension and then that actually underlie development of hypertension. Quite a lot of very prominent figures in the field were saying, well, this is very strange. I mean, how this is happening in atherosclerosis, we can understand that this is happening, but why in hypertension? Yeah, and now I think we have evidence in not only in animal models and cellular models, we have evidence in humans, in large populations, that that these mechanisms play a role. And of course, the question is, how can we really now use this either diagnostically or therapeutically? And I think is a general question for the field of cardiovascular inflammation. But it is I think we are getting there with recent progress in the field of coronary artery disease and atherosclerosis. But I do believe that we are also coming closer and closer to hypertension and cardiometabolic disease per se.
Thank you very much. Wonderful. Filippo, over to you.
Well, before asking my question, I invite all colleagues who are in the room to ask questions. Please, you can put your question in the chat or raise your hand. We are eager to receive your questions. Tom, my question is the following. You have published important, inspiring papers on the relation between teeth, oral hygiene, and cardiovascular disease. Now, I know what is the possible inspiration for these papers, but our colleagues in the room probably do not know. So can you please tell us what inspired you this incredible series of studies on the relation between teeth, oral hygiene, and cardiovascular disease?
So indeed, you know very well that my wife is a dentist, is a dentist, is a periodontologist. And in discussions with her, she made me realize that the actual frequency of periodontal disease in our mouth is very high. And I don't know if our audience knows the prevalence of this disease in the United States, for example, in the most recent studies is up to even 60 to 70% in the mild and moderate forms and 30% in severe forms. So it's actually a surprising resemblance to prevalence of some of the cardiovascular diseases, including hypertension. And this, as these oral diseases are associated with immune activation and inflammation in general, I think they create a unique model in which we can look at the relationship between various cardiovascular diseases, including hypertension and oral pathologies, including mainly periodontitis, as almost like an autoimmune disease of the mouth, because this is what underlies this disease. And in this area, thanks to the ability to work very closely with my wife and her team in Krakow, we managed to develop a clinical trial in which we randomize people to either very intensive treatment of periodontitis or moderate treatment of periodontitis. And we performed a 24-hour ambulatory blood pressure monitoring in these patients over the course of the treatment and after the treatment, and followed up number of different markers. At the moment, we are working to design a multi-center study focused on blood pressure, although it is a difficult one, because, you know, as part of this, I reached out to some of the colleagues with whom I had an opportunity to work on some clinical trials in the past, including Salim Yusuf, and they said, maybe you could incorporate this in one of your trials. And he says, yeah, well, but, you know, the problem is if you send the people to the dentist, they may actually not go, and then we would have a problem with the trial in general. So it's a very risky moment. If you can give me a mouthwash that will remove the oral disease, then we are in the game, and we can do it in a large population. And so far, it's very difficult. I'm learning from my wife. There is no magic mouthwash at the moment, but maybe one day.
Well, thank you, Tom, for sharing with us this remarkable experience, proving that family in our life is extremely important and can inspire interesting developments. But as we are dealing now with inflammation, and I see in the room one of the top scientists in the field of inflammation and cardiovascular disease, Peter Libby. Peter, I think that when we come to residual risk, the burden of infectious diseases is important, and this data from Tom prove that, in particular, the burden coming from the mouth can play an important role. What are your feelings about the future of residual risk? Are we happy with colchicine? Is enough, or we can do better?
Oh, we can certainly do better, and I'm sure that many agree with me. And of course, colchicine has recently been clouded because of the Crea Synergy trial. And stay tuned, readers of the European Journal of Cardiology, because there's going to be a very interesting debate about the substantive contributions of Crea Synergy. But Tom, you mentioned that people were skeptical when you and David Harrison and Connie Weyand published your JX Med paper implicating adaptive immunity and hypertension, which I think is a landmark in the field. And of course, I embraced this immediately. And I can remember one particular meeting when David and I were speaking at a meeting in New Orleans, when I suggested that we could switch our carousels. This was pre-PowerPoint, because he was working on adaptive immunity. I think I was talking about risk factors, including hypertension. And so many of the pathways are shared. And I think that really was among your many contributions, that was a landmark. And I was certainly not skeptical when I saw that paper.
No, thank you for this, and I appreciate, and you know, especially what's coming from somebody who has revolutionized cardiovascular immunology like you have throughout your whole life. I mean, I have to say that, you know, we've been reading your reviews and original studies for decades on understanding how these mechanisms are unraveling, and I think that our work is also trying to move a little bit towards understanding that the way hypertension is actually a risk factor for coronary artery disease and atherosclerosis is not only via the pressure and the sort of mechano-dependent elements, but maybe by common mechanism of inflammation that is a very important potential route. And I think potentially this is essential. And looking beyond colchicine, I think it's very, very important that we focus on identifying mechanisms, maybe common for various cardiovascular conditions, that are more linked to the metabolic aspect of immune system, rather than just bluntly either inhibiting it via strong anti-cytokine treatments, or even less specific, because, you know, I always emphasize colchicine is an antimitotic drug as well, which will affect various other cellular processes beyond immune system. But I think it's an exciting time, and thanks to you and Paul Ritker, we really are closer to people saying, yes, we can actually do something about it, and that I think is really great. I think bringing it back to periodontitis, I think these sort of non-pharmacological ways to try to tackle inflammation that's already there is also a valuable approach, because we need to treat these people anyway, but very often we don't have sufficient sort of stimulus to this, because the patient is just thinking, well, you know, I have some slight bleeding from my teeth when I brush, so I will just brush a little bit lighter, and then it will not bleed, and they don't appreciate that it carries a huge cardiovascular risk. And risk of systemic disease, and you know, this is also a big mission of my wife within the European Periodontological Society, where they are trying to convince people that this is actually a big systemic risk factor. But I think these are hopefully in the future.
Well, Tom, you're not you you are you have many talents. You're not only a top scientist, but also a successful editor-in-chief of cardiovascular research. What attracted your interest for this position?
So as I already alluded to, I think that for me, this sort of work within the ESC, work within the journal, gives an opportunity to interact with unique people and learn from unique people, and I think this is what I get in return for all the hard work that I have to put in this capacity, including meeting people that are here today, you, Peter, and others, and I really appreciate this, and this is, I would say, something that motivates me. The other thing is that you know, I would like always to be involved in something that is important, that's making some difference, and I think that that publishing within science is a very important aspect of our work, and contributing to this gives a chance to really make an impact, and I think that is these two elements, I would say, are the primary drivers for me.
Well, yes, as editor-in-chief, I fully share your comments. To organize a journal as an editor-in-chief, I think is a nice model of how teamwork can be successful. Teamwork is always important in our life, but in organizing an important scientific journal, a full organization, team working with colleagues who are on your same wavelength and the same passion and the same interest and the same perspective of the future is something which can really make the journal more important and impactful. It's a nice model in this regard. But coming to CBR, what are the main novelties you introduced in the past few years?
So I think, you know, the cardiovascular research is our basic and translational research journal of the society, and we focus, our team focus very hard work on ensuring that it's encompassing the full breadth of our field. So I think that was one of the first and the most important aspect, is to make sure that we are very welcoming for all areas of cardiovascular science and cardiovascular research, even including some of the clinical work, although we have to be very careful, and you know, the Council on Basic Cardiovascular Science is always raising this, you know, is this really a journal which should publish studies, clinical studies or trials? And you know, as we say, I think clinical study or a trial can actually stimulate very important questions for basic scientists. And we limit number of these sort of papers that we publish, but we are also not completely abstaining from this area, especially if these are studies or trials that are asking important questions regarding mechanisms of cardiovascular disease. But I think that you know, when our team was starting these years ago, we were observing a decreasing number of submissions to the journal, and in general there was a concern that maybe in general the basic science field is slightly slowing down, and fortunately it has turned around, and you know, at the moment when we took over, we were receiving around 900 submissions per year, and at the moment we exceed 2,000 per year. So this is actually a huge amount of work for which I am very grateful to the whole editorial team, but also to the editorial staff that has to process all of these thousands of papers and help us fairly and transparently assess this. So I think this is one element. The second is to really, a little bit similarly to what you have done with European Heart Journal, broaden further the group of associate editors. And the model of European journals is slightly different, for example, to the American journals, where we have a larger number of editors. It sometimes requires more work from the editor-in-chief, because we have to always serve as a common hub for all of the decisions. But thanks to this, we sort of create a big family, as we call ourselves, the Cardiovascular Research Family, to which I invite all of you. If you are not part of it, then you should start reading our journal, because it's very interesting. And I think that we created sections in which we try to explain certain mechanisms and basic science discoveries to clinicians, and ask clinicians to sort of stimulate questions and explain clinical phenomena to our basic scientists, to maybe inspire them to ask new additional questions in science. And I think these elements work quite well as well. And I think that, you know, we have a huge honor, similarly to European Heart Journal, that we really have a wonderful group of reviewers, and you know, they really provide a very thorough and a very well-balanced assessment of papers in the 99% of requests that we make. And it's actually, you know, I have worked as guest editor in some other journals, sometimes smaller, and I could appreciate how much more difficult it was to really convince these top people to review for us. And in cardiovascular research, at least, we really get a very good response of the reviewers to the requests, and I think that is something that is very valuable. We also opened the journal for social media, for involvement in the past. We focus a lot on the X, but now it's raising a lot of questions. But we still have a good community on that platform. But we are also developing on other platforms, including LinkedIn and others. We produce materials, including some interviews with leaders in cardiovascular research and cardiovascular medicine field to sort of inspire young people. And then we have, and we are restarting this year, a series of webinars that took us a bit, we took a break because there is a lot of webinars that are available, and our sort of market research is indicating that the community became a little bit tired with webinars. But I want to return to this because we had a unique format of webinars where we combined in a webinar a young researcher and already a very accomplished and advanced researcher in the same 1 hour webinar. And I think that this is something that I really want to restart. We are working on this process at the moment but we need to make sure that people will attend in sufficient numbers. So I think these are sort of innovations that we aim for. We are thinking towards creating an open, becoming a sort of an open access journal in the relative future. But as you know, this is a complicated process.
Yeah, thank you for sharing with us your experience, and definitely running a journal is more than publishing top papers. Also, these additional activities, including webinars and social media, are important in creating a good link between journal and readers. We're also facing many challenges, and you are investigating very well what are the challenges and opportunities offered by artificial intelligence. Can you share with us your experience?
So I think that the challenges are involved in copyright aspects of the artificial intelligence, in particular from the perspective of publishing, because especially open language models, they don't know, where do they learn things from. They are a little bit like us. I mean, we read something somewhere and not always remember where the knowledge comes from. And in the case of large language models, I think they really don't know. And even if they are now equipped with some ability to provide references, as you know very well, if you use this sometimes, they really provide relatively lousy references. So I think that this is the copyright aspect of this is a problem, that they are learning from everything, and I think we need to be aware of this. I was recently participating in a meeting of one of the grant consortium in Europe, and a company that creates apps was part of this, and they requested to stop recording in Zoom because they said that all the words that we are saying in a Zoom meeting are sent to OpenAI for processing. So and we don't even realize this, yes, when we make a transcript of our calls, and they are the app developers, so they know. So I think these are potential challenges, but I think there is more benefits of AI than challenges, and the help in speed of finding information that then of course we have to verify because we take the responsibility for it is increasing. The accuracy is increasing. The capacity to support us in practically any aspect of work that we want to use it very responsibly, I think is there. Of course, some people are raising, maybe in 4 years or 5 years, we will all stop thinking because we will always type in, and the large language models or anything else will help us understand it. But then I think that while from the perspective of a regular person, using ChatGPT, Copilot, or anything else, it is mainly about large language models. AI is much more than this, and I think this is something that many fields and areas of our life still don't understand. I mean, we could see this huge crash in the markets everywhere when this DeepSeek was released by China, but people do not appreciate the large language model is a superficial. It's just like a front of a store, but the capacity to use artificial intelligence, machine learning for data analysis, for creating and supporting hypotheses, for development of methods, both in the basic and in clinical arena, in digital twin approaches. I mean, all of these are incredible opportunities. And I think we really live in very exciting times in medicine, where we start curing diseases with gene editing and so on, and instead of treating them, and where we are really experiencing these huge opportunities that the digital revolution is bringing. And I think it's a very similar situation that we experienced many years ago when the whole system of the sort of economy was changing from feudal to capitalist, and the industrial revolution was happening. I stand with people who believe that AI is bringing this revolutionary capacity to us. It's within our reach how we use this.
Well, I invite again our colleagues in the room to ask questions. It's a very stimulating dialogue today. I told you before that Tom is a colleague with many talents. Now there's a new talent. I think Cecilia is going to unveil for you. Please, Cecilia.
Yeah, thank you, Filippo. Yeah, you also are a big humanitarian, And I heard a little bit about your experience in Poland. I'm sure everybody's in Africa. I'm sure everybody's hugely interested in what you did in Africa and what made you go there.
Thank you. I don't know. I wouldn't say that I'm really a huge humanitarian. I think it's a bit of an overstatement, especially, as a scientist. I think we need to keep in the right perspective. But, I have working with my brother and his team, a humanitarian organization in Poland called Doctors Africa that sends young physicians and medical students from Jagiellonian University in Poland to African hospitals to work for 2 to 4 weeks. And this activity he has been developing for many years, but I have never joined them. I mean, I joined him in creating the charity, but I never really went there. And, when you ask me why I never went, is because I thought that going to Africa for 2, 3 weeks, 4 weeks is too short. It really doesn't make any difference. I mean, it's kind of, I thought, not maybe sufficiently helpful. And when I went there this year in July, and I spent 1 month working in rural hospitals over there with these young colleagues, I noticed that even one day in these hospitals, they really want this. People who are working there all the time, who are very inspiring. I have to say that, their outlook on the patient, their breadth of medicine that they have to do every day is incredible. And the strength of people who are running these hospitals, who have to organize everything, is also amazing that you can observe there. But I learned that it actually makes sense, that they really appreciate this. And they always ask, when are you coming next time? Can you come even for 2 weeks? If they are asking for the professors of Jagiellonian University to join, and there are some people who go there routinely. And I think it's an incredibly enriching experience when to see this different world, the problems that they face, and it also makes you approach your problems in a different way. I mean, people say that after coming back from Africa, you never think the same way. It changes the way you think, but it's true. You change the way you think. You change the way you approach your problems. Not only because of the simple thing that they have maybe bigger existential problems than we do, but they also have a different way of approaching these problems and life. They are much more calm. They are much more joyful in the face of different difficulties than we are in the Western culture. And I think that we can learn a lot from them as well. So I find this very humbling experience, but also I learned that it really makes sense to go there, and I encourage everyone to do this because it's a wonderful experience.
Well, thank you. So thinking a little bit about sex and gender and inequities in healthcare, is it, according to your experience in Africa, is it different between the Western countries and Africa?
No, I'm not an expert in this, but of course, you can see the differences, and there is very different. This aspect is very different at different levels of society within and probably even within different countries in Africa and in the Western world. I think that women in Africa are showing even more resilience than women in the Western world. They really need this to grow. But when I now have an opportunity to work with an organization called ARUA, which is an association of research active universities in Africa, and quite a lot of leadership in these universities is actually female. So I think that this it is a very well developed on this academic level. In the levels of various levels of society, I think the socioeconomic aspect is playing a much greater role and having much greater effect over there than even in the Western world. But I think it's probably similar problems that are met there and solutions that are being developed. I think from this perspective also, huge effort for gender and sex equity in the European Society of Cardiology, also in the ESC Congress, that we are really developing with a focus on having a truly balanced participation of women. And I hope women will join, because, you know, the problem is that when we design the first version of the program, we have an exact balance. We really are very happy and successful. And then it turns out that our female colleagues are often so oversubscribed, they are unable to accept the proposals and the invitations. So please accept our invitations to the Congress.
Well, thank you for your efforts, and I'm sure we also like to call upon women to accept these invitations, because it's really so important to achieve this balance. But going back a bit to Africa, what about the cardiology, the future of cardiology in Africa?
So I think that, you know, there are some centers there that are very, very well equipped and well developed. And we have visited such centers in the capital cities and so on. But I think the big problem is with this huge shift in cardiovascular risk that is occurring at the moment in the African continent. In the past, the main causes of morbidity and mortality were infectious diseases. At the moment, it's actually hypertension. Number one cause of morbidity in African continent is hypertension. So it's very similar. They are undergoing very similar sort of change of risk factor structure for cardiovascular disease as we had a number of years ago, and they are much earlier in this process. This is linked to obesity, to urbanization, to many other factors that are under focus and scrutiny now. But I think it's a place where we can make a real difference at the moment. The other element is, you know, we write our guidelines thinking about, you know, ourselves, and then we present them globally. So we need to have a more and more global focus on this aspect, because we need to appreciate that global element is very important in proposing guideline solutions.
So maybe we have a participant from Africa. In that case, please come forward and ask a question in the chat. I don't see any questions there at the moment. But while you're thinking, I would also like to go back to your chairmanship of the Congress program for Madrid, which is going to take place in Madrid. Can you tell us something about what are the main themes and the innovations that are going to be focused on?
So the main spotlight of the Congress is global health. And this, we have discussed this a lot today about the importance of global health, but our sort of sub-theme that we are saying is you know, global problems, but local relevance. Yeah, we want to make sure that we present, for example, how similar clinical problems are being solved in different regions of the world. And this is also enabled by a close collaboration, because in this Congress in Madrid, we are actually co-organizing, and our partner in this endeavor is World Heart Federation, which gives us an opportunity to really tackle these problems properly and be very open about it. So I think that this is a very important element of this. The aspects that we are trying to also deliver for participants this year is firstly focus on the future of cardiology quite a lot, to try to explain to people. As I mentioned before, I think we are in exciting times where therapies are changing, the ways we diagnose, biomarkers, all of these things are undergoing huge developments due to AI, due to new discoveries, gene editing, and so on. And I think we want to explain to cardiologists working in everyday setting where these innovations are and how we are going to benefit from them. And we have a track which is called New Horizons in Cardiology. We will also have something called Discovery Poll, where we will have an opportunity for closer discussions. We also appreciate that the congresses and the reasons people come to Congress are changing, and people come to Congress to meet other people more than just to listen to talks, because you can listen to YouTube video. You don't need to travel across the half of the world to learn about the guideline, because you can listen a very excellent 30-minute YouTube video and learn from this. And young people are thinking this way. So we need to create opportunities for these interactions, and we are creating this space within some of the areas of the Congress, which will be kind of reminiscent of a fireside chat, where leaders will have an opportunity to talk to in direct way to various people, and we will have a very heterogeneous aspects of the program. And of course, we aim to strengthen the program and continue our strengths. So guidelines will be presented, and new trials will be presented. We are looking and very actively trying to create a great offer for excellent trialists to present huge progress in cardiology, as we always do. So I think that that these aspects are unchanged, and hopefully we will develop them further. We have a large group of trial seeking individuals who help us identify studies that may be very useful to be present. And I am sure we will have an opportunity to hear about all of these innovations in Madrid. But these aspects, I think, are important to look in the future of cardiology.
Thank you. Well, we just have a question here that connects to the African situation from Frederick Rahl. LP(a) is an independent risk factor for acute coronary syndromes, and LP(a) levels in Black Africans are much higher than in the Western world. But the prevalence of acute coronary syndrome is still relatively low. Can you comment on that discrepancy?
I think that one of the very important elements that you learn from looking at the data from African continent on risk is that the risk structure and risk factor structure in Africa is different to Europe. And that's why we need to take this into account when we think about the guidelines. This is one aspect. The second aspect is that prevalence is often also related to the ability to diagnose. And, you know, this is the big question. Is the prevalence really lower, or are we just having a diagnosis more rarely, or you know, people die without the appropriate diagnosis? I think that that these all aspects play some role in this process. But I think in Africa a lot of other factors may play a role in development of cardiovascular disease that are different to Western countries, and that includes infections, for example. Yeah, the infection burden over there is or exposure to various microbiome is different and can modify this process. And then finally, I think that it's you know, the availability, for example, of LP(a) screening in Africa is still suboptimal. So we really would need much better access to this in order to answer this in a meaningful way.
So thank you very much. Please, Filippo, would you like to continue?
Well, yeah. Again, Tom, thank you for this conversation. And what you are telling us is really inspirational. And I get two elements in your comments. One is innovation. It's a word which recurs in what you say. And the other is the enthusiasm you put in what you do. And these two elements, look for innovation and enthusiasm in what you do, can really make your life very interesting. And this is really a good example for our younger colleagues. Coming to science, briefly, what is the most exciting thing in your pipeline?
So we are continuing work with our colleagues on understanding some of the more sort of specific mechanisms through which metabolism regulates the immunity, but we focus recently more and more on neural mechanisms of this regulation. We do it on the level of populations in the UK Biobank, for example, using various genetic tools in order to address the question. We published a paper in European Heart Journal not so long ago, in which we identified the brain structures that are actually affected by hypertension hypertension and can mediate development of dementia and cognitive impairment. And these sort of aspects are teaching us about the way through which brain interacts with our organs. And we have had an opportunity to work with a group in Munich that of Andreas Habenicht, who were first to describe that actually in human blood vessels there are sensory nerves, the nerves that are sensing something and telling something to the brain that something is happening in the blood vessel, for example, in atherosclerotic plaque. And part of the work that we want to develop now is to understand what they are telling the brain, and you know, whether we can actually interfere or understand this signal in a better way. And I think that is a very exciting area. But I also must say that, you know, when we started doing the immunology research, I remember David Harrison brought some immunology textbooks, and we were studying this, and we could appreciate that, you know, it's very complicated, all this immunology. And then, you know, now that I'm starting to look at the brain, I have to say it's even more complicated. It's really another level of complexity, with every little area of the brain and center in the brain responsible for something slightly different. So I think we have a huge capacity that is really underappreciated at the moment. So this is one area of our focus, and the other area of the focus is cardio-oncology, where we are trying to follow up on the work initiated that I already mentioned, where we characterized the mechanism through which chemotherapeutic drugs affect blood vessels, and we are trying to understand, you know, how we can tackle this. Can we try to sort of understand cardio-oncology slightly differently? And I think this is important because at the moment, if you look at cardio-oncology guidelines, at least of the ESC, there is one line that refers to blood vessels. All the rest is about the heart and the cardiac myocytes. So very little is actually appreciated how cancer and oncology is affecting blood vessels. And I think this area is very important because the cancer is associated with increased cardiovascular risk and risk of heart attacks and strokes.
Thank you, Tom. It's really an exciting perspective. And let me come now to my final question. I always ask our guests. We now have an archive of more than 40 dialogues, but I'm interested in your passion for innovation, and we always want to improve what we do. What are your suggestions for dialogues? How can we improve them?
So, you know, this is a very, very nice initiative. And I have to say that, you know, as a person who is also running a journal and initiates various initiatives, I look at this a little bit envious because it's a very good format. I have to say, we often have webinars where we deliver lectures, but this sort of very spontaneous and direct discussion where you can learn from and about people is very valuable. So huge congratulations on this format. But I think one element that one could consider is to move and involve to the greater extent the young colleagues, our young community in this process. I don't know, maybe you already are involving them into to a large extent, but to the larger extent than it is, because I think then this is, as I mentioned, I mean, in our webinars, something that was particularly appreciated was the fact that we brought in the young community to do this. And I think that would be a very interesting aspect. Of course, you know, how to do this in a way that it's not becoming too long and it's very well balanced is always a question, but I think there is a growing number of really excellent young scientists that we can open ourselves to.
Well, thank you, Tom, for this suggestion. Definitely, we will pursue your suggestions. Again, we all like innovation, and thank you.
And something that just came to my mind, because, you know, as I said, I like the spontaneity of this format, is maybe, you know, we are creating this fireside chat in the Congress, which I like very much as an idea. Maybe part of this could be some sort of a dialogue that can be recorded as well on site over there in this sort of informal environment with a real-time presence of people. Please think about it, and if this is of interest, then let me know.
Wonderful. Thank you, Tom, for your stimuli. And thank you, Tom, for your participation today. Congratulations for your outstanding achievements in so many fields. And thank you, Cecilia, for running this dialogue with Tom. It's been enjoyable. As usual, as usually our dialogues. I hope that we all learned from this human experience Tom shared with us. And I hope to have, as Tom was suggesting, to have always more and more young colleagues with us. We have a duty towards them because we want to involve them and help them developing their career in the best possible way. So this is also one responsibility for those of us who are diversely young, but not anagraphically young any longer. Thank you, Tom, for these comments, for your suggestions. Thank you, Cecilia. I remind you that the next dialogue will be on March 27 at 17 CT, as usual. Thank you for your participation. We hope to have more questions from the audience next time. And have a nice evening and see you in 1 month. Thank you, Tom and Cecilia.
Thank you very much. Thanks a lot. Thank you.